But first, a day of shock medical announcements from the royal family as it was revealed the Princess of Wales and King Charles have both been unwell. Kate is recovering in hospital after undergoing planned abdominal surgery. She's expected to remain in the London clinic for 2 weeks and isn't due to return to royal duties for 2 months. The palace didn't disclose details about her condition, but said it's not cancer-related. Kate was last seen in public with her family at the Christmas Day church service in Sandringham. It's been reported Prince William will be at her side and will postpone several of his own engagements to support his wife. Well, only 90 minutes after that shock announcement, Buckingham Palace said King Charles will attend hospital next week for treatment for an enlarged prostate. His condition's benign, but will undergo a corrective procedure. The 75-year-old's public engagements will be postponed for a short period of time. I mean, very often when we talk about royal news, there's a lot of overexcitement and, over dramatization, and it's all big news when actually it's not that big news. This is big news. I think, Kate's condition, obviously, King Charles, David, I'm sure you will explain exactly what that's all about in just a minute. So just to talk about Princess of Wales, 2 weeks in this day and age is a considerable length of time in hospital. That suggests it was a major surgical procedure or surgical procedure. 2 months off work for somebody as fit as she is, again, is a considerable length of time. So I think the royal family will be very shocked. I did take comfort from the statement. It was detailed. It was very no-nonsense. It didn't seem like they were being overly shady about what was going on. But having covered royal stories for many years, the royals don't necessarily tell us what's going on, and as they shouldn't have to, what's going on within their private medical life, unless they really have to. And this is a situation where they clearly have to explain where Kate's going to be for 2 weeks and recuperating for 2 months.
Yeah, I mean, I looked at this and obviously my phone was quite red hot from lots of clinicians around the country, everyone speculating about what she may or may not have. But on a personal level, I'm glad she's had the procedure. Obviously, I'm delighted it's not cancerous, so that's a good thing. That's the thing that everyone would be worrying about. But you're right, in terms of a length of stay, it's significant. And that got me thinking she's had some sort of major surgical procedure, particularly an abdominal procedure, where the muscles have obviously been certainly surgically interfered with, so that takes a lot of time to recover from. And then really we can only speculate as to what the cause of that is. But of course it was planned, it was an elective procedure, it was carried out, and we found out after it had taken place, and she's obviously recovering well.
And David, just to explain what the significance of the King's announcement was, because again, I rather like the fact that he said he was going public with this because it's sort of nothing to worry about, but he wants to encourage people to get them checked.
And that is brilliant. It's so brilliant, because my father died of prostate cancer, and it's one of these causes that I feel very passionately about. It is benign, so that's great. 50% of men over 50 get this. It's where your prostate enlarges and it sits underneath the bladder and squeezes on the urethra, and it causes some unpleasant symptoms. So it means you pop to the loo more often, you have to run to the loo, you may have what we call terminal dribbling, which is once you've finished, you then have to go again, you can get sexual dysfunction. But what it proves to me is
I just got to pop out.
It's not a laughing matter.
No, it isn't. But I mean, in some ways, what is great about this is that this is what people get. 50% of men over 50, 80% of men over 80 will get this.
An enlarged prostate, not prostate cancer.
An enlarged prostate, indeed.
It is
and so he's gone in, he's having a procedure which will basically core out the urethra and hopefully resolve those symptoms.
But what I find interesting, sorry, Ed, what I find interesting is that Charles is using his condition to tell everyone, what it is, to encourage men. And obviously, as men, we don't go as often. If we're sick, we tend less to go to doctors. But Kate has chosen, and we're not speculating what her condition is, but she's chosen to keep quiet about
that is
exactly.
interesting, yeah.
And that seems strange that they've both come out on the same day with one person taking a very different direction.
Well, is it strange? Because if the King has this benign condition and we don't know what Kate has, and obviously it's much more severe in terms of the length of time she's in hospital, then obviously that has a very different feel to it, doesn't it?
I mean, I think JJ makes a good point, actually. I hadn't really thought about that because, I do respect Kate Middleton's, the Princess of Wales's privacy, but it will lead to endless speculation. We're not speculating on this show. I mean, my overwhelming feeling, and Isabel said it's not a laughing matter, I did feel very sad, and I am a royalist, and it does bring home to you, I think, how important the royals remain in our life. And if you are somebody who was looking forward to the Princess of Wales visiting your community centre or whatever in the next couple of months, you will be devastated. You'll obviously be very sad for Kate herself, but you will be devastated. It will be one of the highlights of your life. So people do rely on the royals. And, you know, I was being a bit facetious about it earlier. You know, we could end up with Prince Harry having to come back, you know, off the bench. But these people are important in our national life. And when something like this happens, particularly, you know, I heard that she'd had this surgery, and then it was only later that one realised how serious it was in terms of convalescence.
Yeah.
It's a big deal.
Yeah, I mean, you make an important point about the disappointment of those who were expecting her to be at functions. And I thought on that note that the statement that was put out was really well judged. You know, it wasn't a finger wagging to the media, you know, can you all back off and respect our privacy? And, you know, which is what you typically get from celebrities in these cases. Actually, the tone of it was, we are so sorry, I'm paraphrasing here, for all the people that were hoping that she was going to turn up for a charitable event or whatever. And I thought that was actually really charming and very, very well advised. On the prostate thing, my dad also died of prostate cancer, but my dad was a twin. And both twins had prostate cancer. And the difference in my dad's case is that it was caught really early. And he lived 13 years after diagnosis without a single admission to hospital overnight or any operations. So it is highly treatable. In this case, we're not talking about something cancerous, but what has clearly happened is that the king has been well monitored, and intervention is taking place, and hopefully that's the end of it.
And one community that we need to reach out to, JJ, black men who are very poor at coming forward.
1 in 6 or 1 in 4 black men.
I think it's it's more than that.
And it's 1 in 8.
Yeah,
yeah.
So and black men tend to be very reticent at coming forward, and of course it tends to be very aggressive by the time it presents.
Yeah.
So anything that can be done, I think, to spread awareness of this and to say to people, look, if the king can have it, then you can have it.
Yeah,
go and get checked.
And obviously, for men, it used to be a case of having to have something put up through your bottom. These days, it's a prick, right?
Well, I think you do a digital rectal examination, so you feel the shape of the prostate. I mean, we still do it. The PSA test, which is a blood test, isn't very good. It's not very accurate, but it's helpful. And then really what you need to do is an MRI of the prostate gland.
It's going to be difficult for the royal family, though, over the next few weeks, because they've got Kate completely out of action. And as we've all said, she is a crucial part of the royal machinery. She's, her and William are the most popular royals. They're the ones that everybody wants to see, wants to read about. They really fly the flag for the royal family very, very effectively. We've got William out of action because he has now said, in a very modern way, and I'm sure most of us would really applaud this, that he wants to be at his wife's side in hospital and looking after the children.
It's the children.
So he's cancelling some of his appointments, exactly, to do the right thing.
I mean, if mum's in hospital for that has a huge impact on day-to-day family life. And they are very involved parents. You know, this is not a family that just delegates childcare to a succession of nannies.
And then we've got the king out of action on medical grounds. So actually there are going to be a lot of...
So who would like to step in, Dave?
Well, the first thing that they've said is, so we have this system called councillors of state, which are the stand-ins, the royal stand-ins, and they have to come in pairs.
The B team?
So when the monarch...
like a football team.
When the monarch, either through ill health or being abroad or whatever, can't perform his or her duties, 2 councillors of state will perform them on his or her behalf. The Buckingham Palace has already said that they don't think the king is going to not be able to perform anything. He's going to continue doing doing his duties and so on. But I think for some of William and Kate's engagements, we certainly will see probably Anne doing more, Edward doing more. We might see, that is going to be slightly disappointing for some of those people. As much as I admire those royals, they're not the box office that Kate or William would be. So it will be difficult.
So William's going to step away from everything for the next 2 months, or he's just going to do a little bit less?
Because
they do have 2 nannies who help them. I know they're not living nannies, but they do have 2 nannies.
No, I think it's mainly for the period that she's going to be in hospital. And also, I expect we'll see a lot more of Carol Middleton. She's a very hands-on grandmother. I'm sure that she'll be... And, of course, they live nearby to Bucklebury now, nearer than they did. So, but there will be people very, very upset about this and wanting to know... Ed's one of them.
Not that she's going to visit me, but I'm just upset in general. I'm just upset in general.
Well, obviously, we all send our good wishes.
Indeed.